Hello, everyone. Today, I have a very special guest with us. Her name is Dr. Jodie Thomas. She's a physiatrist specializing in the powerful connection between menopause and the joint pain, muscle pain, etc., etc. So she helps women understand the hormonal changes and the connection between the muscle health and the joint pain and the overall wellness. Today, we will dive deep into the musculoskeletal syndrome of menopause with Dr. Jodie Thomas. Dr. Jodie, we are very happy to have you because I know for a fact that this is going to help so many women out there who are so confused with their muscle pain and joint pain and they can't figure out what's happening to them. So welcome, Dr. Jodie. Can you tell us a little about yourself? What is a physiatrist? How did you end up specializing in menopause? It's a unique combination.
Well, first of all, thank you, Swati, for having me, and able to talk with you about this topic. It's so important. Half the population is experiencing or will experiencing these symptoms at one point or another. So I am a board certified physiatrist. My parents still don't know what I do. Okay. So I went to medical school and then I trained in a specialty. The longer name for it is physical medicine and rehabilitation. And we don't do surgery, but we really look at recovery. And one of the reasons that I chose this specialty is it's not organ based. It's not just looking at the heart or the kidney, but it's looking at everything. It's looking at how we function, how we move after injury, either from pain, spinal cord injury, a stroke, how do we get better from it?
Beautiful.
So recently, I became menopause certified because I was seeing women in middle age with these very vague symptoms of shoulder discomfort or plantar fasciitis, like hip pain. Although, mostly, doctors will say, oh, it's arthritis. There is also a role of what hormones do to our overall musculoskeletal system.
Right.
So this term, the musculoskeletal system syndrome of menopause, was coined in 2021, about within the past 5 years, really looking at the array of symptoms that women in either perimenopause or menopause can experience.
Correct. So most people have heard about hot flashes and mood swings. How come women haven't heard about musculoskeletal syndrome of menopause? So what is the reason? What do you think?
One is those, as we're getting older, right? We, when we experience any kind of joint symptoms, it's usually, said to be, oh, it's arthritis. Oh, it's just getting older, right? And so it's not really paid attention to. So as women are, in perimenopause or menopause and they experience symptoms of, either hot flashes, or, waking up in night sweats, those are really problematic symptoms that, that's menopause. But there are a whole host of symptoms that are related to perimenopause and menopause. And, that includes, the musculoskeletal system. That includes the joints, the ligaments, and the tendons.
So true. Because I myself have suffered with musculoskeletal syndrome of menopause like crazy. But for others, I would like to ask you this question: that what does a woman with MSM feel like, and what should it say? Like, when should they know that they need to go to a doctor for this? So tell us something about it.
So I'm going to start just anecdotally. I've had friends and family, in this age group say, my shoulder all of a sudden is hurting, right? So rotator cuff, arthropathy or tendonitis tends to be a big one. Plantar fasciitis, heel, getting up in the morning and heel, stepping on that foot. Heel pain tends to be another big symptom.
Absolutely.
So, and the other symptom is like kind of this morning stiffness. When you're young, we can just spring up, off the floor, get on our hands and knees and roll around. So what happens is as our estrogen levels are decreasing, there are ligaments in our synovial joints, in our joint lining, in our tendons and ligaments. So as there's less estrogen running around, those tendons get up. I would say it's a spectrum. I would say, symptoms, most, symptoms related to menopause actually start in perimenopause. And, as we are undergoing those changes,
hormone fluctuation,
the symptoms, the symptoms can increase, right? In the beginning can kind of go up and down. And as it gets longer, in the process, it can actually get worse.
Right.
more uncomfortable.
Yep. So I have been there. I know how terrible it is. Had I known that there is something like a physiatrist like you existed, it would be just a life-changing thing for me, because I was there without any support. And as you said, they send me to pain management, nerve test, but you know what? Nothing helped. And I was like dying, literally dying in pain. So, and you will not believe, a few months after that, I hear one of my friends suffering through this. Next thing I know, someone else is suffering through it. And I keep telling them, but now we know that Dr. Jodie Thomas is there to help us. It will actually change everybody's life, I'm telling you. So we have heard a lot about inflammation, estrogen, a lack of estrogen that creates the inflammation in overall body. So how does that show up in the musculoskeletal system? Like you were just mentioning.
So, so certainly, estrogen is, when we think about estrogen, it is one hormone that we should consider as a big anti-inflammatory hormone. So that anti-inflammatory hormones, it certainly has effect on our joints and ligaments. And, two of the body systems that I want to quickly mention, it has an anti-inflammatory system effect on our heart and, blood glucose. Those are, kind of the three big symptoms or areas that estrogen plays a role in.
Yeah.
So when we're talking about, estrogen is an anti-inflammatory hormone, right? So it helps with keeping our joints flexible, our ligaments flexible. For our heart, it decreases our bad cholesterol, the LDL. So as estrogen levels go down, and there's less anti-inflammatory factors running around, so LDL shoots up. And the other thing, especially for us South Asians and Indians, what we want to think about is, what estrogen does on our blood glucose.
Yes, true.
So in perimenopause and menopause, when we start experiencing, especially in South Asians, we start experiencing higher levels of insulin resistance that leads to diabetes.
I'm so glad that you brought this up. The heart disease and the insulin part has to be brought up over and over again for women to recognize these symptoms and connect the dots that it has to do with their midlife, their perimenopause, menopause, and their lack of estrogen. And I'm so glad that you are bringing this up. So tell me, when a woman comes to you with a widespread array of frozen shoulder, back pain, and stiff joints, things like that, what is your usual workup like? What questions do you ask that other providers don't? And I know other providers don't because I have experienced it.
So, so certainly, understanding where the woman is, along kind of the spectrum of this midlife changes that happens, right? Is it early on? Is it kind of, mid? Is it mid? Certainly understanding what is, what was that date of menopause, right? That first day of, of your last, monthly cycle, right? After that, it's all post-menopause, right? Yeah. So what I start, this specialty really like touches the body,
Correct.
I really want to, I start with touching the body. Are there joints swollen? Are we starting to see any bony kind of abnormalities, of the hands? Are we, I do a full range of motion, are we able to fully move that shoulder in all ranges, right? Forward, backwards, internal and external rotations. Doing a really thorough musculoskeletal exam. Visual inspection, the joints swollen, any, swelling, is there knee effusion? And then, certainly starting with just basic lab work, looking at, are there high levels of inflammation going on? Looking at, your CRP, your vitamin D levels, especially for us Indians, vitamin D levels, blood work. And then from there, what can be done to move that joint, right? What can be done help that joint, is medications, is anti-inflammatory, appropriate for a short period of time, for a week or 2 weeks, is a course of very focused physical therapy, working on that joint appropriate, if this continues, right, and there are other factors that we were talking about heart disease, and, we talked about certainly, insulin and resistance, is this an appropriate candidate to have or think about menopause replacement therapy?
HRT, yes. Your MHT is a very important part of it. And I don't know how many times we bring this up for women to understand, because when I had frozen shoulder, the range of movement that we were talking about was like totally restricted. It was so hard for me to reverse my car or to sleep on this side. And I think I had to suffer for 6 months just with frozen shoulder and not knowing that this was a sign of perimenopause, not knowing what I know now. And I'm trying to tell people and educate them and make them aware that when you see all these changes, this is time now that you need help from hormones also. And of course, people like you.
It's certainly to think, it's not to say that everyone needs to be on hormones, but certainly that it is an appropriate tool, toolkit,
absolutely.
plus,
Absolutely.
And I just want to say, especially among my Indian friends, frozen shoulder, just anecdotally, I don't have any kind of research to support this, but frozen shoulder tends to be kind of a big joint that's involved.
Yes, for us, right?
Yeah, absolutely.
So what would be the 3 things you would suggest to a woman who is going through perimenopause and menopause? What would be your advice to them?
Okay. My first advice is always, especially, looking through a lens of kind of the musculoskeletal system, is always move. Is always move. Keep moving. So certainly, exercise is really important, right? Exercise, certainly for our bone and joint health, cardiovascular system, and even blood glucose is so important. And I really like to break up exercise into things that, we shouldn't be working out or exercising like we were when we were in our 20s, right? We should really think about, okay, what does, how should we be exercising at this age? And so one is we need to be lifting, weights, resistance training to have impact on our bones, so that the muscle fiber is stronger and the muscle fiber that attaches to the bone also gets stronger. To work on our bone health, you may need to be skipping rope or doing hopscotch, some form of jumping activity. And then the other so we talked about cardiovascular, we talked about jumping. And the other thing is we really want to focus on balance and flexibility. So, as we get older, our with the musculoskeletal system and our nerves kind of, having being impacted, we certainly want to focus on flexibility and maintaining that
balance.
range.
So I would say yoga is a good thing, right? Because I've started yoga and the practice balance, I have seen that because of my 4 years of yoga now, I have gotten so much better with balance. And I keep reading and I keep hearing about balance in midlife and beyond is so key for you not to fall down and break your bone in future.
Right. So key. So definitely, doing one leg activities. Yoga is great. I love yoga. One, it decreases stress.
Absolutely.
And number 2, it's really good for joint flexibility, right?
Yep.
Yes, moving that joint.
And then balance, of course. Balance as well, right?
And balance. Absolutely.
That's my favorite.
I love the tree pose.
Yes, me too. Me too. Yep. No, so that's great. So having understanding like exercise in this stage of our lives, what is your special advice to our South Asian women, our Indian women, to look at exercise in their life? How can they incorporate it? Because a very famous thing that they always say, I'm too busy. I don't have time.
Yeah. Okay, so first I want to start with, what data is out there, right? So there was recently, within the past 2 years, there was a study called the Masala study, okay?
Interesting.
And it looked at 405 South Asian women, and the Masala stands for mediators of atherosclerosis of South Asians living in America.
Lovely.
Okay, so it was specifically for us. So the not so great news about this particular study was that, South Asian women tend to have less muscle mass, less lean muscle mass than other backgrounds and other races.
Right.
And number 2 is, we tend to also have more symptoms of menopause, like, hot flashes and night sweats. And we tend to also have menopause earlier.
Yeah. 46, right?
48 versus like other
51.
races might be in the early 50s.
Yep.
So that being said, so we have a lot kinds of challenges in our way, right? So we have to be very proactive, and certainly, really think about foundational steps. What are the kind of the major building blocks, right? So, we talked about exercise and the different components of exercise, stress relief, yoga, prayer, meditation, to kind of really bring the stress relief down. And then, the other key piece is always, nutrition, right? One thing I have been trying to do is increase my fiber count. Okay. I'm not always successful, but certainly, improving how much fiber we were taking a day, up to 30 grams of fiber a day. And then the best thing is sleep.
Yeah.
Right.
Oh my God, I'm loving it. I'm loving this conversation, Dr. Jodi, because these are my go-to and I absolutely follow them ever since I hit that menopause thing and my suffering. Everything that you said, exercise, yoga, fiber, sleep is key and it has changed my life. Of course, I use HRT and this is like a 360 change in my life, and that ignites my passion to help everybody.
Right.
Because when I look back, me 3 years ago and me now is like a totally different person. I was always in pain, always in pain.
And I think, like your journey and, and sort of my, wanting to learn more about it is like, we want to do for ourselves, make ourselves feel better. And then also being, have that information available, the people that, have that information out there for people, right? And so certainly, I was getting night sweats and I wasn't sleeping, no matter what I did. And so, in addition to the foundational blocks, is, hormone replacement therapy right for you? Certainly just, having a conversation with a physician, to discuss.
Thank you so much, Dr. Jodi. I absolutely, thoroughly love this conversation. And I know for a fact that this is going to help so many women out there who do not even understand that their musculoskeletal pain is first related to menopause and second, it can be helped. So that's
we don't need to suffer. We don't need to suffer, right?
Exactly. I always keep saying that we don't need to endure the pain. We don't need to suffer.
Yes.
Ask for help, understand, and make a well-informed choice. A well-informed choice is what you can do. And thank you so much for giving us such extensive details about the relationship between estrogen and menopause and muscle pain and joint pain. This conversation has been phenomenal. Thank you, Dr. Jodi. And thank you, everybody, for listening. Thank you so much.